Ms. Cole is having a total hip replacement, and I do my total hips a little bit differently than most. I do a minimally invasive approach where the joint capsule and all of the small tendons and muscles surrounding the hip are preserved. And I believe that it leads to more stability and better range of motion in these patients where they're not putting their hip at risk for a dislocation. And I think the recovery time is faster because they're back on their feet pretty much right away after surgery. And I also use a unique guidance system to get the cup position right. So we know as orthopedists, with our long experience with doing this, that it's very hard to position the cup. It has to be done within 5 to 10 degrees of accuracy in 2 planes, and that's very hard for anyone to do. So I've brought with me from Boston a device called the hip sextant that allows me to get that accuracy within 1 to 2 degrees. So in a standard hip replacement surgery, we take down a lot of the tendons and muscles that are just behind the hip joint itself. And just underneath those tendons is a very thick hip capsule that holds our hip in place and provides a tether, limiting our motion. And when we do a standard total hip replacement, we cut through a lot of those tendons and right through the hip capsule. And then we twist the hip in a very unanatomic position, putting the nerve and the arteries at risk for having a disturbed flow and being stretched. So, you know, we get away with it, and that's why we continue to do it that way. And it's still a pretty good procedure, but I think we can do better. The minimally invasive approach is an approach that I learned in my training in Boston. And we're able to preserve all of the small tendons behind the hip, as well as most of the capsule. So we approach the capsule and the hip joint superiorly. We do our procedure without twisting the leg, so the leg remains at the patient's side the entire time. We do not dislocate the hip, and we are able to close the capsule. And so it's, I think we're preserving the most amount of anatomy if you compare it to some of the other approaches that we take in hip replacement surgery. I place a high level of importance on surgical accuracy. Prior to doing any total hip replacement, I go through a very lengthy process of planning. I get an x-ray of the pelvis with special calibration markers that tells me the size and relationship of the bones in the patient, and I'm able to virtually implant the hip replacement in the patient and figure out where it's supposed to go to a high level of accuracy, down to the millimeter. If I were a patient, that's exactly what I would expect in my own care.
When I met Dr. Lee, he was so personable and truly took the time to sit with me and explain, after looking at my x-rays and showing me the x-rays, what it was that he was suggesting I have done. And I asked a lot of questions because that's what I do. It was great. I felt like I was going into this knowing what to expect, and just felt real good about the entire process. But the fact that Dr. Lee took the time to sit with my daughter Katie and me and explain these things and show us how the superpath was going to work, how the hip sextant worked. And then I went home and did some research on my own so I could see more fully what exactly that was. I wasn't sure what to expect as far as movement. I know that he wanted me to be up moving the next day. I was up at midnight that night and walking in the hallways with a walker and a occupational therapist. I was surprised but pleased that I could walk and move as much as I could. 1 week after my surgery, Dr. Lee spoke at a seminar regarding joint replacements, and I contacted his office to find out if they'd be interested in me coming to the event and giving my testimony. His assistant, Chandra, was surprised to see me walking in the way I did because I had no walker, and I felt completely like my old self from a few years before. And I told the people that were at the seminar that my daughter was getting married soon and I would be dancing at her wedding, and I danced in the hallway.
Well, there were certainly some jaws that were dropped when they saw you walking in. I appreciate you kind of showing what's possible. Our inpatient facilities here at Houston Methodist Willowbrook are among the most state-of-the-art facilities in the nation, and they're specifically geared to making our orthopedic patients more comfortable. We have overhead trapezes and overhead frames for all our patients, and we have some of the best inpatient therapists that work with our patients 2 to 3 times a day. And we also have an inpatient rehabilitation center where patients can undergo specialized rehabilitation for their particular orthopedic needs. All of these things work together to make Methodist a leader in medicine, especially in hip replacement surgery.